This study was called a couple-based approach to the reduction of PTSD avoidance symptoms, preliminary findings. Participants were 6 male Vietnam-era combat veterans with a diagnosis of post-traumatic stress disorder, and they were in a relationship with an intimate, cohabiting, and willing marital partner. The exclusion criteria included a diagnosed psychotic disorder, history of recurrent physical or emotional abuse, and a desire to terminate the marriage or the relationship. All couples had been married between 20 and 40 years. They all had adult children, none of which were living in their home. The mean age of the veterans was 59.2 years, and the mean age for their partners was 53.1 years. The pre-testing consisted of structured clinical interview for the DSM-4 to assess the presence of an Axis 1 disorder, a clinician-administered PTSD scale to assess the PTSD diagnostic status and the severity of the symptoms, and also the PTSD checklist. The intervention was the strategic approach therapy. It included 10 sessions and 3 treatment phases. The first phase was psychoeducation about PTSD and motivational enhancement. The second phase consisted of behavior exchange to improve management of behaviors that produce increasing levels of positive emotions. The third phase was partner-assisted anxiety reduction to train couples to cope with exposure to increasing levels of anxiety. They also used modified stress inoculation techniques to increase each couple's exposure to anxiety and positive emotional experiences. They also provided training in communication and problem solving. The sessions included teaching couples about PTSD avoidance symptoms and their impact on intimate relations, a motivational enhancement intervention, as well as to identify spousal behaviors that increase perception, intimacy, and positive emotions, as well as partner-assisted anxiety reductions. So they used a pre-test, post-test group design, and to test for significance, they used a paired samples t-test and a Bonferroni adjustment for a post-test. So the significant results were found for changes in effortful avoidance on self-report measures, as well as the clinician-related reduction. There was also found a change in emotional numbing for the self-reported measures, as well as the clinician-rated scores of overall PTSD severity. There was also a change in re-experiencing for the PSL measure. This is a comprehensive table of all of the reported measures. The first column is the PTSD symptoms measure in general. The second column is the pretest. Third is the post-test. Fourth column is the t-value. And finally, the p-value significance in the last column. Overall, they found reductions in effortful avoidance, emotional numbing, and overall PTSD severity. And there were marginally significant reductions in PTSD re-experiencing and hyperarousal symptoms, and that 3 of the 6 participants showed significant reductions on both of those measures using the CAPS measure. Threats to internal validity included testing effects, as participants were measured twice on several different scales, as well as statistical regression for the same reason. External validity threats included both reactivity of experimental arrangements and reactivity of assessment, and that all participants knew that they were a part of the study for a specific purpose.